Developmental disorders, also referred to as intellectual disabilities, are caused by impairments in the brain or central nervous system. These impairments result from problems that occurred during fetal development or injuries sustained during birth or early infancy, such as cerebral palsy and autism. Other disorders, such as Down syndrome, have a genetic cause. These impairments can impact mobility, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience. Individuals with developmental disorders often function at a lower developmental stage than the average person of the same chronological age. Intellectual disabilities are diagnosed by healthcare providers based on two major criteria: the ability to learn, think, solve problems, and make sense of the world, referred to as intellectual functioning, or intelligence quotient, IQ. The skills and abilities to live independently, referred to as adaptive behavior or adaptive functioning. Intellectual functioning is typically measured by a standardized IQ test. The average score of an IQ test is 100. People scoring below 70 to 75 are thought to have an intellectual disability. To measure adaptive behavior, professionals look at what an individual can do in comparison to other individuals their age. Skills important for adaptive behavior include the following: daily living skills such as getting dressed, going to the bathroom, and feeding oneself. Communication skills such as understanding what is said and being able to answer. Social skills with peers, family members, adults, and others. Adaptive behavior is much more about how a person manages in daily life and their ability to do the things that are expected of their age within their culture. Without ongoing support, deficits in adaptive behavior limit an individual's functioning in many areas such as communication, social participation, and independent living at home, school, work, or in the community. A person without adequate adaptive behaviors requires caregivers and other types of resources depending on their level of impairment. As a nursing assistant, you may be providing most of their needed support. Levels of severity of intellectual disability and associated care needs can be categorized into mild, moderate, severe, and profound. It is important for nursing assistants to know what can be expected and how to care for individuals with these levels of disabilities.